GLP-1 agonists like Semaglutide and Tirzepatide are everywhere today. We hear it all over social media. They're promising dramatic weight loss with just one injection per week. But what do they actually do to your body?
As coaches, we hear a lot about, should I try it? Is it cheating? Is it sustainable?
Today, we're going to break it all down from a medical and coaching perspective. So whether you're thinking about using GLP-1s or you're coaching someone who is, this is what you need to know. GLP-1 agonists are a group of medications originally designed for type 2 diabetic patients. They mimic a peptide called glucagon-like peptide 1 in the body, which helps regulate blood sugar by increasing insulin secretion and slowing down gastric emptying. Semaglutide, with the brand names of Ozempic and Wegovy, and Tirzepatide, with the brand names of Mounjaro and Zepbound, also work in the brain by dramatically reducing hunger signals. That's why a lot of people can lose dramatic amount of weight without even changing their diets. But that's also why side effects like nausea, constipation, and muscle loss are so common.
Let's see what we have learned from our clients and people at the gym. Appetite is drastically reduced, which helps you control that urge of binge. Blood sugar and insulin sensitivity are drastically improved.
Overall, they're a great tool medically for patients with PCOS, prediabetes, and insulin resistance, but they're not magic and they come with real trade-offs. So what are the cons? The biggest issue is muscle loss. Up to 30 to 40% of weight loss is usually muscle mass, especially if you're not eating enough protein or lifting weights. They can have long-term effects on digestion and gallbladder health, and they don't teach behavioral change, which means that once you're off the medication, rebound weight gain usually follows. GLP-1s can be a great option if you're dealing with obesity-related health risks or metabolic syndrome. They can also give people a jump start into a healthier life if they use that window in order to build better habits.
But if you are looking to lose like 10, 15 pounds and you are already active or leanish, that will make you lose muscle and create you a disorder with food.
That needs to be part of the conversation too, because if you do have a history of eating disorders, these meds can worsen restriction and obsession around food.
Ask yourself, do you want quick results or sustainable ones?
If you're willing to train, eat enough protein, prioritize sleep, and play the long game, you don't need a GLP-1. But for some, it can be a therapeutic tool, especially when supervised by a medical professional who gets it. We are not anti-GLP-1s, but we are pro-education, pro-lifting, and pro-long-term health.
So if you're considering to use them or try to build that body that you always dreamed of, with or without meds, just send us a message and we can help you.
Hit like, subscribe to our channel, and drop your questions in the comments. We want to keep this conversation honest and always science-based.